Balloons airborne at midnight, but also circulating here is COVID. Some say they were afraid of getting reinfected but still wanted to celebrate the new year. People here are hoping for a fresh start. After months of tough lockdowns, the recent and rapid undoing of China's restrictive COVID-0 approach has left many eager to socialise.
Now the virus is spreading and there are so many millions of people in China that are now being infected that it once again becomes a threat in terms of the development of variants for the rest of us.
It's not known how many cases China is dealing with. The official number is suspiciously low, but there are real concerns cases could land in Canada, carried by travellers. As an additional measure against the surge, Canada is introducing a requirement for a negative PCR or rapid antigen test, targeting those arriving from China. That starts January 5. It'll run for a month and be reassessed if and when China releases more of its data on cases. China-bound travellers say they're happy to oblige on their way back.
It's okay, protect the others. It's okay for me.
It's good for all people. I think it's good.
Australia, the United Kingdom and the US have brought in similar measures, but some critics say it's too late to try to contain COVID at national borders.
You don't have to go to China to get COVID-19. You can get COVID-19 anywhere you actually try to get it. This is an endemic respiratory virus, and I don't think testing requirements are going to really substantially slow the spread of a virus that's everywhere in the world.
Still, at least 11 countries have decided, along with Canada, that it's worth a try. Georgie Smythe, CBC News, Vancouver.
For some further analysis, we've got Dr. Isaac Bogosh. Doctor, this situation in China, what level of risk does it pose for Canadians?
It's not zero, but we know there's now 1.4 billion more people on the planet who are at least at risk of getting COVID-19, which just means the probability for more mutations and more variants of concern to develop goes up, which poses a greater risk globally. Obviously, we want less COVID, not more, but it probably won't have that significant a risk for us in Canada or elsewhere around the world. It's unfortunately more of the same.
Okay, and now here we are, day one of the new year. What does 2023 in COVID look like?
You know, we'll probably see more mutations in the virus as the virus continues to do what it does. We'll probably see more waves of COVID-19, but you know, with time, and we will see hopefully less and less impact on Canadian society. You know, and some dissociation, as we're already seeing, between the size of the waves in terms of cases and then the impact that it has on our healthcare system and with deaths, for example. Now, of course, we don't like COVID. We want less COVID, not more COVID. But between the protection we get from infection and recovery from infection, coupled with vaccination, hopefully we see less and less of an impact. Having said that, I think it's very important to communicate uncertainty because there certainly is some uncertainty into the months and years that lie ahead.
All right. Dr. Bogosh, thanks very much.
My pleasure.